Hi, I'm Dr. Rohit Arora. I'm a pediatrician and neonatologist at Cloudnine Hospital, Golf Course Road, Gurugram. Alright, so a crying baby. Now, this is probably the most common reason of visits for the parents, especially in the emergency hours, that the baby is crying unconsolably. Now, few things please keep in mind that cry is a way of communication. That's how babies communicate. They don't understand or know the language at this moment. And therefore, a good healthy cry is a sign of good health also. In fact, in most cases, it's just a sign of hunger. So, by default, you're supposed to consider every cry as a hunger cry and start to give feed to the baby. In most instances, babies will stop to cry because when you're holding, it's not just that they are hungry, it's just that once you hold them properly, bring them closer to you and give feeds, they tend to calm down. Please keep that always in mind, that so don't react to the cry. It's important for babies to cry because that's how they communicate. Now, other important reasons of cry are that wet baby will always cry, right? So, babies has passed motion, baby has passed urine, babies tend to get wet, they soil their diapers and then they start to cry. So, if you have given the feed, baby is still howling around, so you can check the nappy of the baby. So, a wet baby, make sure that you make the baby dry at that moment and baby will stop to cry. Then another common reason for cry is that, overclothing. When you wrap too many layers of clothes, when you swaddle them very tightly, they will cry. So ensure that the environmental temperature is normalized, not too hot, there is some ventilation happening, and then you loosen up all the clothes. Then the babies will probably stop to cry. Then another common, not very common, but another reason of unconsolable cry, as we discussed in previously also, is the ear discharge. Any ear discharge, babies will cry a lot. Right? Another common, especially in North India, is a mosquito bite. It can be very, very painful in newborns, and mosquitoes somehow have a liking for newborn babies. So they really cry when they have a mosquito bite. So you have to rule out one by one all these reasons, starting from hunger, which should be your default setting, that you should give feed to the baby, bring them closer, calm them down, rock them gently. All these things you have to do. Then make the environmental temperature normal, look for any signs of mosquito bite, look for any signs of ear discharge, and then act accordingly. So, long story short, don't really react to the cry, try to look for the reasons for it, give the feed, improve the environmental temperature, and in most circumstances you will find that babies have stopped to cry. Also, during the colic age, when they are in the middle of night, they might develop those cramps, which can be distressing to the parents, but they also generally settle down by the time it's morning. So cry is an essential way of communication by the babies. You have to be proactive and try to find a reason if the baby is inconsolably crying. Thank you.